Dubai is a very unique, progressive nation where this location, of course, is strategic, being very close proximity to a lot of the nations and a lot of the continents. The trade policies and the world-class infrastructure. I mean, look at the ports.
Now I'm going to address the elephant in the room, women in business leadership.
This region has been extremely conducive to empowering women in business. And I don't see that many barriers anymore. Like, I often speak at women empowerment sessions, and I do say as a first opening statement saying that women don't need to be empowered. They are empowered because they are the creators.
Hello everyone, welcome to another episode of the Live, Work and Play in Dubai podcast season 2 for Economic Times. Today we will continue to delve into the industry shaping Dubai's future and the industry stalwarts who are really at the center of making this creative ecosystem, the Habibis who are building in Dubai. And today we have a very inspirational Habibi with us, Dr. Shahdadpuri, Managing Director of the Nikai Group. Welcome, Dr. Jean.
Good morning to everyone, and it's an honor to be here.
Absolutely. The honor is all ours. So I'm just going to take 2 minutes to just introduce her, though her bio is so impressive that 2 minutes don't do justice. But Dr. Shahdadpuri, I think, is a kind of leader who makes me believe that she has some extra R's, or at least an AI clone. She has a very, very expansive career focusing across multiple industries and geographies, including a medical practitioner and then leading policy health roles such as the COVID Action Task Force in the US. As a managing director of the Nikai Group, she's made this organization into a global powerhouse, ranging from everything to electronics to real estate, all the while embracing excellence and sort of innovation. If that was not enough, she also now is a full-time entrepreneur, having an organization called Pansophic Technologies, which integrates AI into every industry solution, whether it's healthcare, banking, manufacturing, and you name it. All the while being super humble and approachable. So it's again very, very nice to have you here. And if I missed anything, please feel free to add.
Thank you, Shraddha. You very kind words and
all true.
A very flattering introduction. So thank you for that. I think we all try to make an impact, a drop in the ocean, right? So there's still lots to be done and lots to be looking forward to here.
Can I just say, for you, I think you're not a drop in the ocean. You're actually creating the waves. So with that, let's delve into getting a lot of information and insights from Dr. Jean. So Dr. Jean, as I said, it's been such an impressive career that this podcast will not do justice. So let me just pick up bits and pieces of it. Let's start with your current role as the MD of the Nikai Group. What are you doing in the organization and what are your passions and expertise?
As the managing director of the Nikai Group, which was a move that happened post-COVID, Nikai Group, Nikai is the flagship activity. Nikai is one of the fastest growing household brands globally, and it's renowned for delivering cutting-edge, innovative consumer electronics, FMCG products, and technology-driven solutions. At Nikai Group, I try to drive innovation and operational excellence across consumer electronics and all the operations across the organization, ensuring that we always have high quality, reliable, and smart products that seamlessly integrate into modern lifestyles. All of us are busy in our households. Our devices are our life. They make it easy or convenient to be able to get to work as soon as possible. We have started using our devices to enable our working lifestyle, and they hold our lifeline, right? So at Nikai, we try to focus on smart appliances, smart electronics. We have a sharp focus on market expansion, supply chain optimization, so just in time, and strategic innovation. We're redefining some of the industry standards where it comes to technology integrating with appliances and electronics, while we are evolving our product range and streamlining logistics and scaling our FMCG portfolio. We also leverage technology as a game changer to enhance efficiency, elevate customer or consumer experiences, and solidify our global presence.
So what are some of these, eye-catching smart equipments that Nikai is working on these days?
So imagine something like walking into your household and your refrigerator identifying you by your face and saying, "Welcome, Shraddha, welcome home. Well, I see that it's Wednesday and you're on your vegan diet. We have some vegetables and fruits in the fridge, but our tomatoes have expired 2 days ago. And should we order a new batch of tomatoes through delivery from a store?" And it's integrated with your payment platform, including, "Hey, Shraddha, your mother's birthday is tomorrow. Would you like me to order some flowers as well while we're getting these tomatoes from the store?" As well as, I think your recipe of making salad is missing quinoa, so should we also get that from the store? Something like this, including the temperature of the room you're in, making sure your phones are charged, or making sure you have everything you need in going through your day every day. So if you have smart devices, they just make sure your life is so comfortable without you realizing, without you having up to walk to switches and looking at things in the cabinets and the fridges to make sure you have everything just in time for when you need it.
I would give my kidney for a product like that. Being so lazy and living on my own, this would be like music to my ears.
And luckily, organs is not what we take. So
absolutely,
we're very affordable, and that's the whole thing, right? I mean, you don't want the rich and famous alone to have these. They have to be affordable for normal working masses, normal middle class families who have more to do with their time than to take care of the chores around the household work.
Absolutely.
And chores, I mean, mundane tasks that you go to the bank to withdraw cash, you have you call to pay your bill, and it takes you 45 minutes to be on hold and pay your bill. All this, if it's on a scheduled time and integrated with platforms that already know what your payments are due every month, why can't this be done by somebody who is not you?
Absolutely. So I'm going to take you back now to your formative years, your experience as a medical practitioner, and then leading several key policy platforms in the US, right? So take me through, some of your experiences, that trajectory. How was the experience for you?
So being a child of an Indian parents and a household, of course, one child had to be a doctor and one child had to be an engineer. My brother is an engineer, so of course that left me with medicine. And so I really didn't have a lot of career choices except for medicine. And so I became a pediatrician, studied in Albert Einstein University in New York, and practiced as a pediatrician in Stanford and Northwestern in Chicago. Soon after that, I jumped into administration and did my healthcare executive MBA in California and became the medical director of an administrative entity in the UC health system. So from there, my healthcare leadership role started, and I realized that if you could make an impact of one patient at a time as a practitioner, you could make an impact of hundreds of patients as a physician executive leader. From there, I gained a lot of knowledge and experience and realized, well, if you're in a health system and you're in the administration now, you can probably make sure you can impact hundreds and hundreds of patients. From there, I joined a managed care, which is an entity in the US that involves all the stakeholders to put their skin in the game. So you have a patient that is on the hook for their wellness and health. You have the doctor to make sure the patient is well and all the preventive screenings are done and to keep the patient healthy. You have the insurance company that has a skin in the game. They contribute to keeping the patient healthy. They save on costs and hence earn more revenue and save more, which in turn goes back to the patient. So in terms of premiums, you have subsidized premiums for somebody who's taking care of themselves and is healthy and is focusing on preventive screening. Okay. And that's a perfect model where all the stakeholders are doing the right thing, which then if goes into millions and millions, actually now impacts being productive citizens of the country and gets to contribute to the economy much more than the higher disease burden countries do. Sure. And we realized this because California had a lot of deficit and we were spending a lot on healthcare costs without any improved outcomes. And we said, what do? Let's get everybody who's on the table and put their risk on the table so that they are involved with doing actions that is driven towards proactive approach and keeping the patients well. That's how managed care formed in California, and there were different models where once they did the right thing at the right time and intervened at the right time in the patient's life, all those savings went back to the people who did it.
No, perfect. I think COVID was a pivotal moment for many of us. Some of our other speakers have also said they moved from Singapore to Dubai at that time. Somebody moved from Europe to Dubai. Dubai was that bustling, environment at the moment. But for you personally, how did the transition happen from a medical practitioner to an MD, to an AI pioneer, and from like a policy role to CEO? Though there are synergies. And what were some of the highs and lows and challenges of this transition?
So I think you're so right. I think COVID impacted all our lives in a very unique way. I happened to be working at a state and a federal level when COVID happened, and it was crisis management at a different level. So the healthcare workforce was under pressure, under stress, and clearly we didn't have enough providers to take care of the workloads and the masses that were getting hit by this virus. This, along with the R&D being on steroids, so the vaccines and the medicines that had to come on fast enough without proper clinical trials and the duration that it actually takes for a normal process, kind of didn't have an option because it was a disaster situation. To take decisions so quickly based on the information you have, based on the expertise and the knowledge you had, and then implementing it and measuring outcomes and then course correcting it if that wasn't the right thing to do. But it involved not just medical supplies, PPEs, body bags, ventilators, oxygen tanks, beds in the hospitals space, including the workforce that was getting into the mainstream, right? So we had students, pharmacy students that went on an accelerated program, medical students, nursing students that went into accelerated programs, just so that we could make them available.
So Nikai Group was started by your father. I've met him, very, very inspirational, dynamic personality.
Yes.
And he made it into a global powerhouse. And you really, really sort of carried out the legacy. You made changes in the way staffing is done, the way reporting happens, sort of outreach to sustainability, healthcare, etc. So what kind of leadership does it require to make a sort of a family business into this global powerhouse, professionalizing everything? Not to say that your father didn't have his own brand of professionalism. True. But how does that happen?
So my father, Shahdadpuri, is an exemplary visionary leader who saw the potential in this market and understood the consumer's need and the consumer's voice. And that's what I think, we learning it from fancy words in the MBA schools. He understood it right at the grassroots level and got the brand to come at a level where it became a trusted household name in every single household, not just in UAE, but the GCC region and 51 countries in total. So we have about 550 odd products, and we have sold it to about 70 million odd customers around the world. Now, this takes a lot of understanding. How do you be agile and dynamic in a market which is, of course, competitive? And how do you get enough momentum so you can scale it up to the extent to reach everyone and in everyone's household? So it was not just marketing, it was not just product, but I think it was a promise of reliability and high quality at an affordable price that got us there. When I came into the organization, of course, at a time which was around COVID, we needed to digitize a lot of things and think of innovative ways of how to move our workforce remotely. Being a distribution hub, all about being hands and people on the ground and trucks and fleets on the road, how do we coordinate that in a seamless way digitally so that it's a seamless delivery of the goods to the person who needs it or the retail channel who needs it? And I think that's where I came in and implemented some systems and processes and a governance structure that actually involved implementation of an advanced ERP system during COVID that could integrate our incoming purchase imports to warehousing in our state-of-the-art warehouses and being mechanized and automated enough that it required least bit of human intervention. And then track our fleet management on the roads as well as managed to do a just-in-time delivery to the end consumer. That then holds true for the service needs of the end consumers, which obviously happens in household appliances and electronics. And how do we make sure that's seamless with a 24-hour turnaround to a level of satisfaction that they need? This also involved a lot of systemization of the sales force that we had on the fields and where they were and what information and data they needed on the field at the point of service through technology and through our systems.
Absolutely. And I think you've also been involved in a number of the critical trade deals and business deals that India and UAE have been a part of, and sort of they've just nourished that. So tell us some of the synergies that are emerging in the India-UAE business corridor, and how are the companies positioned to take advantage of this?
Sure. So one of the initiatives, just one of them, and a big one, was a brainchild of Dr. Thani Al-Zayudi and leadership at large, was called CEPA. And CEPA is now, if I'm not mistaken, in 13 countries. That was started with India in May 1st, 2022. The CEPA bilateral trade increased by 21% from 43 billion to 83 billion. And they have a target of making it to 100 billion by 2030. And I'm sure it's on its way and it'll get there. The India export alone to UAE is 30 billion, and it's mostly gems and petrol products, equipment, pharma, etc. UAE export is 53 billion, and that's mostly oil and gold, aluminum, dates, dry fruits, etc. These are very, very strong numbers when you think of two countries that have shared long legacy bonds and relationships across a very unstructured channel like the boats and the ships that used to come across. At one point, the currency of UAE was in rupees. I don't know if you know, and that wasn't so long back. Well, from there to now, with these expanded business corridors, has a huge scope for tremendous growth here. They have very strategic supply chain partnerships now with a lot of the Indian manufacturers, and Nikai is obviously leveraging and taking advantage of a lot of these synergies. We have a lot of cross-border logistics efficiencies because of Dubai's trade policies. So, of course, now we're getting a lot of made in India goods over here. And then making it possible to get the India diaspora as well as the Indian subcontinent to avail of all those products. We're exploring market expansions in key sectors like FMCG. So, you have your coconut oils and your sauces and your spices, which have a big meaning for all the diaspora over here, including the local diaspora who has been brought up by a lot of Indian spices themselves. Yeah. So I think I see a lot of strengthening of almost borderless cultures and borderless business, just enhancing and enriching all the cultural values between both the countries.
Super. So now I'm going to address the elephant in the room, women in business leadership. When you move to Dubai, it is a region which is, very fast evolving in terms of, inclusion of women leadership. What were some of the barriers you faced, and what would be the advice that you would give to a number of budding women entrepreneurs, startup founders, investors, etc. in the region?
Honestly, living and most of my career in the US, it was very conducive and inclusive environment for women, with diversity and equality being part of it. Now that a lot of the world is moving away from it, I find this part and this region stepping forward and owning up to the same values that a lot of the other world was supposed to stand for. I see that the leadership has already made a lot of forward-thinking steps, like having most of their cabinet members, 50% as women. And we actually see these bright, dynamic, agile, hardworking, and sincere women who are juggling with their personal life as well as making huge strides in all kinds of industries like commerce, trade, space. And I'm so proud of that, because this is clearly a top-down approach. This is leadership encouraging them, nurturing them, empowering empowering them, getting incubators and accelerator programs and training programs to develop these young leaders. I, however, see even the public-private partnerships looking at a similar environment of equal opportunity. Now, Nikai, the core heart leadership philosophy is diversity, equality, and we have learned how to recognize talent, nurture, and empower this talent. We think our wealth is not our products, but it's human capital. And it's the team that you have, and it's the strategic C-level team that helps make the strategy for the future. And how agile and dynamic they have been. And we believe in including a lot of women and strong leaders into that same DNA of our company. And I think it's essential, right? Because they are half the human capital, and if unutilized, imagine the potential that's been left on the table. They also take these values back to their families and their children, and incorporate these leadership skills in their children, which is something that they don't realize, but they're building the next gen in the country that's going to be their human wealth and capital wealth. True.
Any final thoughts, Dr. Jean, on Dubai, on startups, on India-UAE corridor, on your personal journey?
For the youth and for men and women, I think just aim high, dream big. The hurdles and obstacles are just a way for you to learn and have a stumbling block. But then please get up, walk, and then run, because you will achieve greater heights if you believe in yourself. And this environment is definitely going to be facilitating and enabling you, and not in any way or form hindering your progress. So be open, be receptive, collaborate, network, learn along the way, and have fun. Make sure you have enough yourself time and downtime to unwind, recharge, and take care of your health and mental health as well, and take care of families and communities and friends, because at the end, that is what would leave a mark behind.
I'm glad we closed with the topic of mental health and sort of family and professional life balance. But ladies and gentlemen, it's a wrap. It's been a super conversation, Dr. Jean Shahdadpuri. If you've liked the conversation, please share, subscribe, and stay tuned till next time, where work meets opportunity and opportunity meets success. So live, work, and play in Dubai Season 2. Thank you, guys.